Polycystic ovaries. I think I have polycystic ovaries. I'm 22 and I'm using antidepressants and Concerta, which is a medication for ADHD. That shouldn't have anything to do with polycystic ovaries. So polycystic ovaries, I asked her what symptoms was she having. So she mentioned she has irregular periods, spotting, thinning hair, hair loss from the head, acne, and fluctuations in weight. Also, she has lots of facial hair. A lot of facial hair. My pelvic area also hurts and itches from time to time, and it looks red and swollen. Discharge is yellow and curdy. Right, so some of the symptoms she mentioned, apart from the last ones, which is the yellow and curdy discharge and the painful pelvic area, are typical symptoms of Polycystic Ovarian Syndrome. Irregular periods. You might have hair in the male distribution. Some women get hair on their chest, they get hair on their abdomen, they get hair on the chin. Some women notice thinning hair. They might have, what we call the male pattern of baldness as well, which is usually an indication that you have high testosterone levels. Because yes, women can also produce, testosterone from the ovaries, but if it's produced in excess amounts, that can cause some of the symptoms, in addition to the irregular periods, which I've mentioned, and weight gain as well. So you want to do blood tests. You want to do blood tests for hormones, such as what we call the LH and FSH, which is usually secreted by the pituitary gland. And usually with the LH and FSH, I would expect a ratio of 1:1 in a normal person. If, however, you've got a ratio of 2:1 or 3:1 ratio of your LH to FSH, this indicates hormonal imbalance. You'd also want to do a blood test for testosterone, though testosterone can be normal in some women with PCOS. However, if it's raised, then that's a high indication of PCOS. You can also do a pelvic ultrasound, which might show little follicles around the ovaries. Usually you get 10 to 12 follicles around the ovaries, but you cannot rely on ultrasound because in the majority of women with PCOS, ultrasound is normal because it depends on when in the cycle you do the ultrasound. Usually the criteria is that you need 2 out of 3 to confirm PCOS. So if you've got irregular periods and you've got imbalance of your LH to FSH, that is sufficient to diagnose you as PCOS. Or you've got irregular periods or acne or weight gain and any of the tests are positive, then you've got PCOS. In terms of management, that depends on what you are aiming for. If you're aiming for pregnancy, then contraception or hormonal medication is not an option because the hormonal medication that's used to help regulate your hormones are also contraceptives, such as your Dianette and your yasmin. But however, if you're trying for pregnancy, this might not be the choice. So therefore, you might think of other medications such as taking metformin, for instance, because metformin reduces your insulin resistance, which in turn reduces your testosterone levels and helps to rebalance your hormones. And in some cases, in addition to metformin, you might want to go on ovulation induction medication, such as Clomiphene, which helps in women who are probably not having ovulate. They cannot ovulate because the luteal follicle is never mature enough to become an egg. So, and in addition to that, you want to address lifestyle. You want to lose weight because if you're trying for pregnancy and your BMI is over 30, it would be more difficult to get pregnant with such a high BMI. And if you do get pregnant with such a high BMI, there is also a risk of miscarriage or complications during birth. So you want to address the BMI, address your weight, as well as making sure that you're exercising and all your factors, blood sugar, blood pressure are all under control.